Good evening, everyone. Welcome to tonight's webinar. My name is Dr. Richard Lipscomb, and the topic of this webinar is provisional crown techniques. At the end of this presentation, I'll be giving you my email address. So if I don't answer all the questions, you have a chance to email me and I'll respond back to you later on tonight. Just a quick rundown of a quick background of myself. I'm a general dentist. I live in Annapolis, Maryland. And I work every day, 9 to 5, Monday through Friday, a couple Saturdays throughout the month, and I do quite a bit of crown and bridge procedures. So that means I do a lot of crown and bridge temporaries. So let's get right into this today. The mindset that I want you to have for this webinar is I'm going to take you step by step in making durable, functional temporaries that, more importantly, you can make and be efficient with your time with these procedures. I also like to make likable provisional restorations, and that starts with making good pre-op shapes of the teeth that we're going to be preparing for temporary crowns and bridges, and also making well-defined pre-op impressions of those same teeth. And lastly, I want you to be able to utilize these tips I'm giving you today the next time you're doing crown and bridge procedures, but more importantly, I want you to be able to instruct your staff in making these procedures a little bit faster and a little bit easier. So this first case, young lady has peg laterals, teeth number 7 and tooth number 10, just came out of ortho, and now she wants these spaces closed around these two peg lateral teeth. And we took a very conservative approach. We decided to do veneers on both of these teeth, and in order to temporize these teeth or make temporary veneers, I had to close those spaces. So what I used in this particular case was just regular composite without any kind of bonding materials or any kind of etching, and just placed these composites around these peg laterals and gave these teeth the shape that they normally should have, and then light cured them to allow that composite to be nice and hard, and take an impression of that as you see on the right hand side. Once I made the impression, I can use this impression as a temporary matrix to make temporary veneers for this case. Now, as you can see, these are the temporaries that we made around tooth number 7, tooth number 10. Tooth number 10, there was less space around this peg lateral, so I was able to make a better looking temp as opposed to tooth number 7. But as you can see, my temps resemble that build-up that I did prior to taking the impression. So that's one of the techniques that I typically will do, not just for veneer cases, but for crown and bridge cases, where we're trying to close up spaces and trying to give the tooth more body and more shape and form before we take an impression of it. So first things first, when I do crown and bridge, I always have making the temporary in mind, because once we prep teeth, we can't let patients just walk out with teeth that are prepped and exposed and not cover them. So I don't use one particular technique to make temporaries, simply because there are many ways in which teeth come to us needing crown and bridge, and so it just depends on the situation. As you can see here in this left-hand side, where the patient has a broken crown 7 and 8, in this situation, I probably would do the same thing in terms of just placing composite on these teeth without the bonding agent, just giving them the form and shape that they would naturally have, and then taking an impression over that to make the temporary matrix. In this situation, we have tooth number 18 with open lingual margins. We're replacing this crown. So in order for me to get a good shape so that I can take an impression for the matrix on this tooth, I would just simply use some flowable composite, close up the open margins, and then take an impression of that. Here you have a tooth number 19 with a broken lingual cusp. A lot of times that fractured cusp doesn't need a complete buildup, and by the time we've prepped this tooth, there's no buildup material left, so In this situation, I probably wouldn't use a permanent build-up material. I'd use a temporary build-up material to give this tooth more shape and more form, and then take the impression from there. And lastly, this picture where we're dealing with spaces, we're dealing with trying to change the shape of these teeth, and multiple teeth, teeth number 7 through 10. In these situations, I like to do diagnostic wax up and let the lab do the heavy lifting in terms of shaping and contouring, and giving not just me but the patient something to look at when we're going through and deciding on what the best treatment will be. So the purpose of provisional restorations, some of the purposes are reducing the sensitivity and discomfort. Remember, we're prepping these teeth and we're exposing the dentin, and those teeth are going to be sensitive. So it's good to make temporaries that are going to be full coverage to make sure that that sensitivity is reduced. Also, these temporaries are there to maintain the function and aesthetics of teeth. Now, just because we're prepping these teeth, and there's going to be a time lapse usually in terms of when the permanent restoration is going to return back to the office. So during that time, these patients need teeth to function, these teeth to be presentable. So we want to make sure that those temporaries can fill that role. Also, our temporaries should be protective of the margins of the preps that we've made. We want the soft tissue to stay where it is and not be moving onto these prep margins, and this is one of the ways that we can do that by having them covered with temporary materials. Preventing shifting and movement of not only the prep tooth but the adjacent and opposing teeth is also very important, and one of the things that temporaries can do. If we don't have good contacts with our temporaries, teeth move, the space in which we've taken the final impression is going to be altered, and so the potential of making a lot of adjustments or not having the final restoration fit at all can be a function of that. And lastly, giving the dentist and the patient a preview of the final restoration. A lot of times, patients, especially if you're doing multiple teeth or anterior teeth, they're really unsure about how this is going to look and feel. So we want to make temporaries that are going to kind of mimic and look and feel like the final restorations, so that to give them a sense of, okay, yeah, this is going to be okay, and we can move forward with the case. Factors that contribute to the fabrication of these temporary restorations: detailed pre-op impressions, visible prep margins, adequate retention of the prep tooth, proximal contact, occlusal contact, and marginal fit. These are all factors that play a part in how I make temporaries. A detailed pre-op impression. I want to try to achieve this with impression materials, and I usually use a triple tray to achieve that. The more detail I get in this particular impression that serves as a temporary matrix, the better chance I have of making a good temporary with less adjustments, less issues and problems that would have at the end of a crown and bridge session. It's always a time kind of thing when you're dealing with crown and bridge. We're rushing to numb the patient up, we're rushing to prep the tooth, and then we're rushing to try to get to the temporary part of it. But it all starts in the beginning, and if we can get and capture a good impression of the tooth that we're going to be working on, then chances are that we're going to make a good temporary that's not going to take us long to make, and we're going to be more efficient in the way we do things. VOCO has a whole list of impression materials that I typically utilize for my crown and bridge procedures. They have the light body material, heavy body material, monophase, and even a putty material that I could utilize throughout these procedures, not just for the final impression for the permanent restoration, but also in making these temporaries. Visible margins and adequate retention. We try to make these margins more visible, now not just for us in making the temporary, but for the lab and them making the final restoration. The better visibility they have with those margins, the better chance the lab is to be making a good final restoration. As far as the temporaries are concerned, having these margins visible makes it easier for me to make adjustments and to trim these temporary crowns in a way that's going to fit well and be pleasant for the patient to have. The products that I use to retract and make these visible margins, one is the Traxident and the other is the retraction caps. Both are by Premier. The Traxident, it's a good product. I use it a lot for most of my retraction of soft tissue when I'm doing crown and bridge. Here it is around tooth number 18. It comes in a syringe. You place it. On top of that, you place the retraction cap and have the patient bite down for a period of about 2 minutes. And then after 2 minutes, you wash the material away. And not only does it do a good job in kind of allowing the margins to be seen, but it also stops any kind of bleeding around the soft tissue areas and the margins of this tooth. As you can see, the margin is very, very visible, and I got adequate amount of retention from the prep that I've done on this tooth. Proximal contacts. When I make temporaries, I want to make sure that my temporaries are touching any adjacent teeth mesially and distally. What this does is prevent that prep tooth from moving in any direction, and it also allows us to have less adjustments on the back end when we go to cement the final restoration. Also, having proximal contacts, it just maintains the health of the soft tissue around the tooth that we prep, because if we don't have any contact, there sometimes can be food trapping that could irritate and cause the soft tissues to bleed. Occlusal contact. Not only do I want proximal contact, I also want occlusal contact, which keeps, again, the prep tooth from moving, tooth erupting, but it also allows the opposing tooth not to move. Again, all this is beneficial on the end when we're trying to cement the permanent restoration. The less movement any of these teeth make, and the more we keep that space mimicking our final impression, the less time it's going to take us to seed our final restoration during the cementation process. Marginal fit. We want our temporaries to cover the margins. This minimizes the plaque retention and staining around these margins. The less plaque we have, the better health of the soft tissue around those margins. It allows the margins not to be it allows the gums not to be irritated with the plaque that may be around the margins. Also, having good marginal coverage, it minimizes microleakage. Microleakage could also disrupt how our temporary cement is seating our temporary crown. So the less microleakage we have, the better chance we are of having these temporary crowns stay in place. These are the steps that I usually take in fabricating temporary crowns. Step 1, forming the tooth for the temporary matrix. Step 2, selecting impression materials. Step 3, choosing the provisional or temp material that we're going to be using to make the temp. Step 4, contouring and finishing the temporaries. And step 5, cementation. Step 1, forming the tooth for the temp matrix. There are a lot of ways to do this. Most of us use permanent build-up materials, especially with teeth that are endodontically treated, where we're placing either some type of core material or some type of post. There's also temporary build-up materials that we can use to allow us to give teeth shape and form without permanently building them up. We also can use prefabricated crowns to give teeth their shape and form. And then lastly, we can do diagnostic wax-ups and models to give teeth shape and form. In this category, we can either take impressions of those wax-ups and models or make vacuum form matrices over those wax-ups and models. Permanent build-up materials, as I mentioned, can be anything from composites to cements to core build-up materials. However, there are alternatives, temporary build-up materials. This is the one I use a lot. It's called Interval by Temerex. It's a soft putty kind of material that's light curable. You can use it for temporary fillings, to temporize onlays or inlays, but primarily I use it to temporary build up teeth that otherwise wouldn't need a full permanent build-up. In this case, we're looking at tooth number 4 with a broken buccal cusp. I'm placing the interval on the buccal aspect of this tooth, and this is a picture of it in place. You can shape this with your fingers, or you can shape it with a plastic instrument. It lends itself to easily being manipulated into any kind of shape and form that you want. And because it can be light cured, it's just a quick and easy material to use. Here we go, where it's light cured and we're sizing it up to take a triple tray impression. Here is a tooth, tooth number 31, with a fractured mesial buccal area of this crown that needs to be replaced. It's causing a food trap for this patient. So in order for us to create the true form of this tooth and not have this food trap when we make the temporary, I've used some clear ortho wax and just kind of placed it into that spot, into that area where there was no contact. When I do this, I also make sure that I use some Vaseline to the opposing tooth. Then I have the patient bite down, and when they bite down, it gives me a good occlusal reference in terms of how that wax can be shaped and formed, and it allows the wax to stay in place. And then once I have a good form of that wax, then I'll take an impression of it. Here's the impression with the wax. The wax obviously is not intact to that crown, so it came out in the impression. And then I'll take this is a 12 fluted gold finishing burr, and I'll take this burr and just give this impression more definition, especially on the lingual and buccal surfaces. And then I'll also take out that proximal material and ensure that up so that I can ensure that when I make this temporary, that it's flush up against the proximal tooth, and that there's no space or gappage in between the temporary and the existing tooth. Once I kind of clean this impression up with this finishing burr, I go back over, clean it out with a wet cotton pellet, because usually there's some residue of the material, so you don't want that residue on your temporary restoration. So I'll go back, rinse it off first, and then go back in and clean it out with this cotton pellet. Same tooth. In this case, I'm using Structure 3 by Boco to make the temporary. I place the temporary in this matrix, put that over the tooth, let it set up, and this is the temporary crown that we've made for tooth number 31. In terms of the cementation that I use, I'm using Bifit by Bifit Temp by Boco again. It's a good temporary material that I use kind of frequently and easy to handle. Place it into the inside of this temporary and seat it in place. Another way to give form to a tooth that needs it is by using the prefabricated crowns. Here is a strip crown. Sometimes it can be difficult to use. To allow them to kind of stay in place, I can I usually put a little bit of wax into the crown itself and then place that onto the tooth. And what that does is it kind of stabilizes the strip crown to the tooth that we're going to prep when we take the impressions. And lastly, one of the ways that we use to kind of give teeth form or trying to change or alter teeth is through the wax-ups and the diagnostic wax-ups and models. In this case, we're working on tooth number 7, 8, 9, and 10. We're going to be doing individual crowns on this, and in order for us to get a better sense of what our options were in terms of extractions, in terms of just doing individual crowns, we decided to do these diagnostic wax-ups. The advantage of having diagnostic wax-ups is that they allow you to work with multiple teeth and long span bridges. And they also allow you to work outside the mouth. Taking impressions are a lot easier outside on models as opposed to within a patient's mouth. Also, these diagnostic wax-ups and models are reusable, especially the models that are made based off the wax-up. These wax-ups give the dentist and the patient a sense of what the lab can do. Sometimes we're not sure if teeth need to be removed, if they're out of place too far and the lab can't do a bridge or can't do crowns and we need to do extractions, or if a tooth is too far out of place and it may need root canal therapy. These are the things that a diagnostic wax-up can kind of tell us from the lab's perspective of what can be done and what can't be done. It also gives the patient an idea of what the temps and what the final restorations are going to look like, which also helps in accepting treatment. Patients, especially when you're dealing with anterior teeth, they're really not sure that this is going to work or how it's going to look or how it's going to feel. Well, what the diagnostic wax-ups do give those patients and give them an idea of what the work is going to look like, whether it be the temporary or the permanent restoration. The disadvantage of these diagnostic wax-ups are there's an extra step that we have to take in terms of taking an impression and send it to the lab. So that's time away from this case. Also, it's not always easy when we take an impression for off these diagnostic wax-ups and off these models to transfer that impression onto the patient's natural dentition when we're doing these cases. So with this case, I did get the wax-up back, looked pretty good, didn't have any issues from the lab. They were able to kind of wax up the crowns in a way that they weren't overlapping, and they looked pretty good. They weren't as protrusive as the original teeth are, so we went ahead, waxed them up, took a PVS impression of those wax up, as you see here. And again, because we're working outside the mouth, we're able to get a good detailed impression to work with to make into temporaries. Here we are. This is the diagnostic wax up. This is how we started before, and then this is the after. So these temporaries, as you can see, kind of don't look like the diagnostic wax up. The thing is that the patient didn't really like the diagnostic wax up. She wanted her teeth to look, at least in the temporary phase, to look a little bit slimmer than her original teeth here in the before picture. And so she was so kind of not liking the protrusiveness of these front teeth that she wanted to kind of steer clear away from that altogether and have more slimmer teeth. So at least in the temporaries, that's what we did to make her a little bit happier. The other way that we utilize these diagnostic wax-ups and diagnostic models is through the vacuum form matrix. And that is when we have a clear plastic sheet and we use a vacuum form to kind of come down on the stone model to create a matrix. Benefits of that, again, is we can use that for multiple teeth, we can use that for long span bridges, and it also can be reusable. But the disadvantages with this system or this technique is that it's an extra step in terms of creating the vacuum, and then it also, they typically will lack the details that we like to see in our temporary restorations. In this case, we're using a diagnostic wax up and the vacuum form to create the matrix for the temporaries. We're going to be extracting tooth number 23, 24, and 26 and doing a 6-unit bridge from 22 to 27. So now in this situation, because we're dealing with teeth that we're going to be extracting, I want a temporary that's going to be long lasting because it's going to be in there for a while. So the first thing we did was, once we got the diagnostic wax up and the diagnostic models back, we did a vacuum form over top of it, and as you can see, it's lacking a lot of detail that we would get normally in the PVS impressions. So we went ahead, day of the procedure. First thing we do, because we know we're going to be doing these extractions, I want to prep my canines 22 and 27. Prep those, got that out the way. Next thing we did was did the extractions of the three lower teeth. Once the teeth were gone, I was able to fit this matrix over top my prep teeth to make sure that I had enough clearance, and it looks like I did. Once that was fitted in place and everything was okay, I used some cotton pellets to be placed inside the extraction site so none of my temporary crown and bridge material would float into those open extraction sites. Once these extraction sites were packed with cotton pellets, on top I placed a thin layer of Vaseline so those cotton pellets wouldn't stick to the bottom of my temporary that I'm going to be fabricating. And then we loaded the matrix up and with the temp material, and then placed it all on top of my preps and made this temporary. Now again, this temporary doesn't have a lot of definition to it, but it is strong, it will be durable. I like to wait at least 2 to 3 months of healing and filling of this bone because of the extraction. So with that, what this lacks in definition and prettiness, it makes up for in the strength of this temporary. So it was able to last a long period of time and allow that area to kind of heal up and be right for the final impression. Again, this is how we started, and this is how the temporary looked. Second step is the impression materials for the temporary matrix. For the most part, most of my single unit temporary crowns, I use this material called Correct Plus by Pentron. It's a bright registration material that picks up a lot of definition, sets up quick, and does a good job of not only making the matrices that I need for the temporaries, but it's also a good bright registration material, which allows us to kind of decrease on the amount of things and materials that are on and around our unit while we're doing these procedures. I like to use triple trays when we're making these matrices. You can use traditional trays and quadrant trays, 4-arch trays and quadrant trays, but the triple trays, for some reason, when you're placing material not only in the area that you're taking the impression of the tooth, but also on the underside of this tray, where the opposing teeth are, when they come together, it just makes a different type of impression of the tooth that you're trying to impress. It allows the occlusal to be more detailed, which means that you have less adjustments when you go to shape and contour the temporary. So Correct Plus by Pentron. I typically, the sequence in which we do this is I'll numb the patient up, while they're getting numb, I still got about 1 to 2 minutes. I'll take the impression with the correct bite with the triple tray, take a look at the impression, make sure it's adequate, make sure it has everything that I need in terms of the adjacent teeth, the margins, and then I'll go again with this gold finishing burr around the margins and define those margins buccally and lingually, and remove some of the interproximal material so that the temporary material that I do use, when it goes into this matrix, it will do a good job of holding on or shaping around the prep in a way that replicates the shape of the tooth before we prepped it. And this is the temporary that we've made. We've checked the occlusion. Again, we want some occlusal contact because we don't want this tooth to super erupt, and more importantly, we don't want the opposing tooth to super erupt. And this is the same temporary with temporary cement. Another tooth, tooth number 8, we're taking an impression with the triple tray and the correct plus. A lot of material interproximally here. So again, taking the burr, removing that interproximal material, making these buccal and lingual marginal walls really defined, so that once we place the temporary material into this slot where tooth number 8 is, I'm going to get a nice temporary that I won't have to adjust a lot to. I won't have to contour and shape that much because of the things that I've done to alter the impression. So this is before, when we just took the impression of tooth number 8, and this is after, where I used a burr to kind of define the lingual and buccal walls and removing the interproximal areas of this impression. This is the temporary. Once we've loaded the matrix and placed that matrix onto the tooth, and once the temporary sets up, taking off that matrix, and this is what we got. This is the temporary after we do some simple contouring and shaping, and this is the final shape of the temporary after cementation. So what I'm looking for in the temp material and the temporary crowns that I want to make. Again, I want my patients to like my temporaries. I'm not of the mindset that I'm going to make good temporaries and the patient's not going to come back. That's not how I think. I want the temporaries to look good. I want them to be functional. I don't want them to be weak. I want them to be durable. I want them not to chip and fracture during the process of the 1 or 2 weeks that the permanent restoration is being made. The other characteristics of the temporaries the temporary material that I'm using is, I want the surface to be hard. I want it to be easily contoured, easily polished, and I find that the harder surface is, the better you can contour and polish these surfaces to make them nice and smooth and shiny, to allow the patients to be able to function in a way of natural teeth. And again, we want these temporaries to mimic the final restoration as much as possible, so that the patients can get a true sense of what it is to have these temporaries, and what it is to later on have these permanent restorations, and they should be similar. It shouldn't be a big gap between the way I'm making my temporaries and the way they feel, as opposed to the permanent restorations that will be coming in later on. Step 3, the provisional material itself. There are a lot of materials out there that people use. We started off with the polymethacrylates. This is the powder liquid method in terms of making temporaries into a matrix and mixing it up. The biggest drawback with this particular type of technique was the heat that it generated during the curing process, and also the shrinkage. There was a lot of shrinkage such that you had to keep taking that temporary on and off to not allow it to shrink onto your prep and not be able to get it off. So those were some of the things that weren't so great about that technique. Now, most people nowadays use the big acryls, which are composite-based materials. Most of them are self-curing and also can be lighter to speed up that curing process, to cut down on the amount of time that you're waiting for these materials to get hard and to start polishing them. The other method of temporizing that we can use are prefabricated crown forms. In this case, we have metal prefabricated crowns and also polycarboxylated crowns. These also can be used to temporize prep teeth. I'm not a big fan of the prefabricated. I typically like to use those just to get me shape and form before I take an impression for the temporary matrix. I think that the biz acryls do a better job of you have a better chance of making temporaries that are more tooth-like in terms of function and in appearance with these types of materials than you do with the preformed crowns, and whether they be the metal or the polycarboxylate. The biscuit acryls, again, I mentioned there's many out there. Structure 3 by Voco, Integrity by Dentsply, Pro-Temp Plus by 3M. They all are good materials. You just have to, find a material that you can use and works well in your hands, but they all have good strength, the aesthetics. Most of them come in different shades, so that shouldn't be a problem in terms of matching them to the patient's liking. And again, the materials that Voco produce, the Structure 3 and the Structure Premium, they come in 2 different delivery systems. One is the cartridge dispensing gun, and the other is this quick mix syringe. Now, I like the quick mix syringe because it's smaller, it doesn't take up a lot of space, it cuts down on the clutter of my unit, whereas before we might have 4 or 5 different guns for different materials. We can at least eliminate one of those guns by using one of these quick mix syringes, which are a lot smaller and a lot easier to use. Both of these materials are 1-to-1 mixing ratio. They use a smaller tip, which allows for less waste of the material. They set up pretty quickly, anywhere between 45 to 60 seconds. And more importantly, if you are using the cartridge gun, their cartridge gun, because it's a 1-to-1 ratio with this material, it's not a special gun. It's the same gun that we use for their light body material, the same gun we use for the heavy body material. It makes it a lot easier as opposed to a special temp gun that you got to use just for these temp materials. And the 4th step is contouring finishing of your temporaries. And with that, again, I use this 12 fluted gold finishing burr. And I also, with anterior teeth where I need more definition and trying to make the teeth or make the temporaries look more like natural teeth, I'll use this flame or pointed cone diamond burr, usually in a fine grid. And they both do a good job of shaping these teeth in a way that I want them to look. I try not to have a lot of different burrs and try not to have a lot of different materials around when I'm doing crown and bridge, because I want to be efficient and I don't want to have a lot of things to choose from. It also allows my assistant to be efficient in keeping up and making sure that we have the things that we need. So the less burrs and less materials that we have, I think the faster those procedures go. And the 5th step is cementation of the temporary crowns. With this, before we cement our temporary crowns, I like to scrub those preps off with a prep cleaner, and this one that I use a lot is called sepsis by Ultradent. It contains hexachloridine, and it does a good job of kind of just getting those preps clean, removing the bacteria, and also this particular solution, it seals off the dental tubule, so it helps in the sensitivity factors with our temporaries. The temporary cements that I like to use, Next Temp by Premier. Again, it's an auto mixing, self-setting material. I typically use it in the posterior area when I'm not concerned about retention. Usually when I'm working with teeth like number 20, and it's in between 19 and 21, where I have good retention. I'm not worried about the tooth coming off or falling off due to lack of a good cement. I'll use this. The other one is BiFit by Voco. It's a little bit different than the Next Temp. It's dual curing, meaning that we can light cure this material. I like using it in the anterior, even though I can use it in the posterior. The advantage of this material is because it's light cured, we can place it in our temporary crowns, then seat it in the mouth, remove all the excess cement, clean things up. Once we've gotten to a point where everything is good, it can be light cured. So I like this material. It flows a lot faster than the Next Temp. It gets into the undercuts, and it does a good job, especially in areas where you don't have retention, or especially in the anterior where you don't want your temporaries falling off. This does a great job of maintaining and keeping temporaries in place. This is the BiFit by Voco, and this is the Next Temp cement. They both come in syringe delivery systems. Once we cement the temporaries in place and remove all the excess cement, check the bite, make sure everything is okay, do our final shaping and contouring, and everything is okay. I like to clean off the temporaries, isolate them, and then apply this thin layer of Easy Glaze. It's a nano-filled, light curing protective coating that it just seals up not only the temporary itself, but also seals up the margins to, again, reducing some of the sensitivity that we may have with our temporaries. It doesn't take much to work with this material. You can apply it with a micro brush or any kind of brush. Just goes right onto the surface of your temporary. Then you kind of air thin it and then light cure it. So from start to finish, first, when we're doing these crown and bridge procedures, we want to identify the tooth that we're going to be treating and then numb the patient up or numb the tooth up. The next thing I want to do is, while I'm waiting for that patient to get numb, I'm making the pre-op impression of that tooth. Then the tooth is prepped and the final impression is made. And then from there, I'm trying in the matrix that we've made prior to prepping the tooth. Once it fits correctly and I know its path of insertion, I want to lubricate the prepped tooth, usually with some type of Vaseline, to allow me to make a temporary that's not going to stick to the prep once we make it. Then I place the temporary material inside that temporary matrix. Then I place that matrix inside the mouth. Once the temporary material starts to gel, then we remove it from the mouth. I typically would use some of my temporary material and just try to put a small portion, like a pea-sized portion of it on the side to kind of give me a gauge of, how it's setting, whether it's setting slow or setting fast, to allow me to take it out of the mouth at the right time. Removing excess, the next step would be removing the excess temp material from the mouth, cleaning everything up, making sure I didn't leave behind any materials that would interfere with the patient's bite. I set the patient all the way up so they're sitting upright, and then take the bite registration. Once I do that, I'm going back to the temporary that I've just made, taking my burrs, reshaping, contouring it, finishing and polishing my temporary. And then the last thing I do is the cementation sequence, which is using the Conceptus, temporary cement, and then lastly the easy glaze. Here we are with, again, tooth number 4, has an existing crown that was repaired, but the repair is not going well, and we want to just make a new crown for this tooth. So the first thing that I did was, because the patient didn't like the way this crown was repaired and didn't like the shape of it, I wasn't going to take an impression as is. So what we did was we removed some of that old composite, placed new composite there, again, not bonding it, but just to give it some shape and some form that it didn't have before, as you can see here in this picture. Light cured it, made it hard, took an impression with a triple tray. Buccal margins kind of washed out a little bit, and this is the opposing arch. With these buccal margins, again, go back with my finishing burr to make them more defined. Since they washed out here, I want to make them more defined here. And once I did that, also removing the interproximal materials so that I have good intimate contact both distally and mesally for my temporary. Once I did all that, I'm going to rinse off this matrix, go back in with a cotton pellet so that I'm reassured that all the residue from that temp matrix is gone and it's not incorporated in my temporary that I'm going to be making within this matrix. We started with this crown here needing this tooth here needing a new crown, and this is the temporary that we made off of that. So again, and that's why it's really important that when you're starting and taking this impression of this tooth for your matrix, you want to get a good shape of the tooth that you're going to be making the temporary for. And as you can see, as we started with this tooth, that just wasn't a good shape. It was impinging on the soft tissue, and it just didn't look good at all. Whereas when we made the temporary, we changed everything up, we took out that material, and we made a better temporary. And this will allow us to have more success when the permanent restoration comes back to us. Troubleshooting. Some of the problems that we have when we're fabricating temporaries, one of them is voids or areas that didn't get captured in our matrix, and or small bubbles that can be in our temporaries. And some of the ways to kind of prevent that from happening is making sure that we're placing these temp materials inside our matrix at a slow rate, and also keeping the temp immersed in the material throughout the whole time as we're filling it up. And also, you want to try to prevent these cartridges from being just opened. You want to make sure that once you've used it and expressed material in it, to leave that tip on there, because that acts as a cover for your cartridge, and it keeps the material without having bubbles or voids in it to start with. Poor margins in the temporary matrix impression, and that happens. Sometimes it's just hard to get a good impression that has definition, and that's why I like to go back in with my finishing burr to make more definite margins with these impressions. Another technique that I use to get more definition without using the burr is a two-step impression technique, where we're taking the impression with the bright registration, letting that get hard and set up, and then going back and adding some light body material, some wash material in that same impression to capture more detail with those materials. As you can see here, this is tooth number 3, washed out buccal impression here, lingual impression here, buccal not too bad. I didn't take a burr to this. I just added some light body impression material to capture the areas that I didn't in the initial impression, and then we fabricated a temporary crown, as you can see here and here. And so had we not had placed this light body material, making adjustments in shaping and changing this lingual aspect of this crown was going to take us a little bit of time. As you can see, like I said before, the lingual area was washed out. So if you can imagine, if I don't have a definite border here, my temp material will just kind of spill into those areas, making that temporary restoration kind of bulky. So, and that would take time to kind of reduce that and get it back into the shape that we really wanted it to be. So another tooth number 18, taking a triple tray impression. Again, this buccal margins, not really there, kind of washed out. Took some light body, put it in the impression, that set up to give me some more definition on that buckle to allow us to make a good temporary. And the thing about this technique is we're using this wash material to make a good solid impression, to not allow the temp material to spread and to go in all kinds of areas that we don't want it to go, which makes our cleanup and our adjustments to our temporaries a little bit longer. So I like using this technique just simply to cut down on the amount of shaping, the amount of adjustments I have to make in the temporary that's going to be made from this. Sometimes when we're using a longer spans of crown and bridges, in this case tooth number 15, 14, and 13, a 3-unit bridge, getting that impression with the bright registration is almost impossible. So as you can see, not only buccally are we losing the impression, but also lingually. So again, that's when this two-step technique comes into place, where you're just putting, again, light body material inside the impression, letting it set up, and because these areas are kind of ragged, not defined, I'll go back in with my finishing burr to make them more defined and more crisp, so that when we make the temporary, it's nice and clear, and again, less time on contouring and adjusting because of the steps that we've taken to make the impression nice and defined. Underfilling the temporary matrix. In this case, we have a chip veneer on tooth number 7. On the distal aspect of it, we decided to replace this veneer. In replacing it, before I took the impression, I kind of built it up again with composite, without any bonding, without any etching, just to give it some more shape, the way it naturally should have had, and then took an impression based off of that. However, in placing the temporary material, I didn't put enough material inside the matrix, and I got this type of temporary. Now at this point, I had some options on how I could handle it. I could maybe just trim everything back on the side like normal, and then cemented this, and then go back and add some composite to kind of fill in and cover this margin. That would be one option. The other option was to just go ahead and make a whole new temporary, and keeping in mind that when I fill up this matrix with the temporary material, that I have to do that in a way that it's fully filled, so that all aspects of the prep are going to be covered. So that ends our webinar for tonight. This is my email address. I'm going to kind of go, I see there's a lot of questions here. I'm going to kind of go through some of these questions, see if I can answer some of them right now. So one of the questions was about the temporary material coming in different shades, and wanting to know if they came in a bleach shade or not. You know what, it just depends on the material. Some manufacturers have bleach shade, some of them don't. You just have to kind of look into it. For the most part, most of them have either a bleach shade, a B1, or a OA shading that allows you to be more aesthetic in terms of making your temporaries. Another question was about making temporaries for implants. I typically, when we're talking about implants and we're talking about single units, your options are kind of limited. I tend to not temporize those situations and try to do the permanent restoration and get it back in a more timely way, so we don't have any type of lapse in times to allow these teeth to move. One option though is when we're doing single unit restorations for an implant, is to make a flipper or single unilateral partial just to go over that area, to again to allow the teeth to stay where they are, because implants are no different from when we're prepping the teeth. When they're spaced, teeth can move, and so I find that in those situations where I'm using a partial, something you take in and out, even though it's for a brief moment in time, it helps on the cementation of the final restoration, because I know that the teeth haven't moved, nothing has super erupted, and I have a better chance of seeing that restoration and making minimal adjustments to the final restoration when I do that. Okay, that's it. Well, I hope you enjoyed this webinar. I hope you got some tips that you can use, and thank you for your attendance.